what we end up doing is we get the individuals who unfortunately have had a cardiac event, be it something maybe a little more minor like stenting to open up a blood vessel, or something a little more dramatic like a bypass surgery where there's a lot of trauma, let's say. And so in terms of secondary prevention, they've already had their cardiac event. So what we are trying to do is rehabilitate them through actual practical physical activity, also through health education on being active for life, dietary requirements, etc., in order to prevent a secondary cardiac event.
So what does that look like then? Somebody has had a cardiac event, they're discharged, they're sent out to your program. What happens next? How often are they coming in?
Sure. So if they've had a cardiac event, especially in my local area, what would happen is they would be put on a waiting list to see if they're even first interested in becoming part of a cardiac rehabilitation program. And if they are, then once that waiting list has cleared, so it's usually about a 3 to 4 month waiting list, we would call them and we'd say, are you interested in coming in for an orientation? We'd get a group of 10 to 12 of them for an orientation, and we'd say, look, this is our program. Here are your requirements, and I explain that in a second. And if you are interested, fantastic. There's really no fee to you. If you're not interested, then that's fine, but you sort of need to know more or less right away, because the waiting list is so long. The government only covers so many spots per year.